Good afternoon, everyone, and thank you for joining us today. I'd like to recognize Governor Wolf for joining us today and for championing critical programs that address health inequities across our Commonwealth. Every Pennsylvanian deserves access to affordable, quality health care and coverage that gives them peace of mind. I'm grateful for the Governor's work to expand Medicaid and create the Pennie health insurance marketplace just for Pennsylvanians. Pennie helps residents find the insurance plan that's right for them. Pennie connects you with financial aid and helps you shop for, compare, and buy health insurance. Nearly everyone qualifies for a savings plan because of the American Rescue Plan. If the pandemic has taught us anything, it's that our health is so important, and getting the proper preventative care is critical to ensuring our overall health and well-being. I encourage everyone who isn't covered to look into Pennie. Speaking of being covered, if you haven't gotten the vaccine, or it's been a while since you got your vaccine, call or visit our health department's website to learn more about the incredible benefits of the vaccine and where you can get a dose. Please get vaccinated. It's free, it's safe, and will help you and your loved ones stay healthy and get us back to some sense of normalcy. And now it's my pleasure to turn it over to one of the best governors we've ever had for Philadelphia and for Pennsylvania, Governor Tom Wolf.
Thank you very much. Thanks, Mayor Kenny. I really appreciate that introduction. And thank you for helping me talk up Pennie. This is a big deal. It's really important that we talk about health equity and access to quality, affordable health care. I think that's a right that every Pennsylvanian has. But just now in Pennsylvania and all across our nation, Americans are being left behind by the current system. And you know, we do have a system of national health care. It's called the emergency room. And what we're trying to do with the Affordable Care Act and now with Pennie, as you'll hear, is expand that and make sure that we have much more equitable and fair access to health care. Because there are deep inequities in our health care system right now. Health care coverage, health care access, and therefore health care outcomes. These inequities were around well before COVID, but the COVID pandemic has only made many of these things even worse. I am committed, my administration is committed to helping all Pennsylvanians access the health care they actually need. From the start, I've been fighting to improve health equity in the Commonwealth. In 2015, for example, my first year in office, I expanded access to Medicaid under the Affordable Care Act, and that opened up health insurance to 720,000 people. That's now over 1 million people who have benefited from the expansion of Medicaid. And I've advocated strongly against any rollback of the Affordable Care Act since then. Because the Affordable Care Act, we have more we have to do, but it provides health coverage for many more, I think 1.5 million people in Pennsylvania. My administration has implemented collaborative and innovative programs to improve health care outcomes for Pennsylvanians and to close the health care outcomes gap that does exist. Last year, I announced a health care reform plan for Pennsylvania to try to produce lower costs for Pennsylvania. We're still working on that and I think making some really good progress. One key component of reaching our goal of accessible, equitable, quality health care for Pennsylvanians was the 2021 launch of Pennie, which is what we're here to talk about today. This is where Pennsylvanians can go to buy health insurance, health care coverage on a state marketplace under the Affordable Care Act. Pennie is the one-stop shop for Pennsylvanians' health care needs. And the Pennie team has worked very, very hard to provide Pennsylvanians with access to affordable, quality health care. Pennie provides world-class customer service to help every Pennsylvanian truly understand their health care options and their health insurance options. And the Pennie team can also provide information about the financial assistance that's available for those who need it. This means health care coverage is more affordable in Pennsylvania, which helps more Pennsylvanians get the care they need, and that's the basis of health equity right there, giving each Pennsylvanian the opportunities they need to live the healthiest life they can. We all benefit from a society that ensures access to health care. When health coverage is readily accessible, businesses see lower rates of absenteeism. Employees can invest their talents. They can explore opportunities without fear of losing necessary health coverage for themselves or their families simply because they choose to go to another place to work. And we all benefit from the economic boost that comes when entrepreneurs have the freedom and the support they need to build new businesses. That's why I'm proud of what we have accomplished in this issue, in this area. During my time in office, Pennsylvania has reached the lowest uninsured rate in the Commonwealth's history. Insurance rates now are the most stable year over year that they've been ever. And hundreds of thousands more Pennsylvanians are covered through Medicaid expansion or through Pennie's marketplace, actually 1.5 million, than ever before. There's more we need to do, however. We can't stop now. We need to do more to ensure health equity in the Commonwealth, and that will continue to fight for true equity. We have to continue to fight for true equity. But the affordable coverage available through Pennie is a very important first step. And I encourage all Pennsylvanians who need coverage to go to pennie.com to explore your health care options. Open enrollment begins today, as Mayor Kenny said, and the Pennie team is standing by to help you understand your options and find financial assistance. But we need your help to spread the word. So please tell a friend, tell a neighbor or a loved one about Pennie today. Thank you, and now I'm going to turn things over to Antoinette Krause, the Executive Director at Pennsylvania's Health Access Network. Antoinette.
Thank you. I first want to thank Governor Wolf, Commissioner Altman, and Zach Sherman for their leadership in making Pennie a reality in Pennsylvania. I'm Antoinette Krause. I'm the Executive Director of the Pennsylvania Health Access Network. We sit down with individuals all across the Commonwealth to help connect them to health insurance coverage. We sit down with small business owners, parents, young entrepreneurs, all have one thing in common: the peace of mind that comes with having access to quality, affordable health insurance coverage. I think we all learned a lot during the COVID pandemic that our public health system wasn't set up in a way that best assisted individuals, but Medicaid expansion and Pennie helped over 1 million Pennsylvanians now have access to quality, affordable health coverage. I want to encourage folks to go to pennie.com and check out what's available. There's new plans, and you'll find affordable rates. Thanks to the American Rescue Plan, 90% of Pennsylvanians are now receiving financial assistance. In fact, this year, 53% of Pennie customers are paying under $1, and 71% of folks are paying under $50 a month. Premiums are half of what they are thanks to actions in Congress and President Biden. We encourage that to continue, and that will continue for next year. So if you've gone to Pennie before, you think maybe it's not affordable, maybe you recently lost your job, maybe during the COVID pandemic you decided, I don't want to go back to my job, I want to start my own business, you now don't have to worry about getting health insurance coverage. I want to share 2 stories of folks that came to our office recently that we helped connect to health insurance coverage to put in perspective what Pennie means for folks. Anna is a home health care worker, but isn't offered coverage through her employer. When we helped her enroll in a silver plan through the marketplace in 2019, her premium was around $150. This year, with the new ARPA savings, she's now enrolled in the same plan for $0 a month with a $0 deductible. These savings are huge for her because she often has trouble making ends meet and sometimes has to rely on her son for help. Now she doesn't have to worry about health insurance coverage. Kenneth had previously enrolled in a short-term plan for $350 a month. He didn't find out that it didn't cover anything until he went to the hospital. He works for a paving company and last year saw his hours reduced. Prior to ARPA, he enrolled last year after finding out that he had a plan that didn't meet his needs. He's now paying $17.50 with a $0 deductible, and the best part, he told us, is that his prescriptions are 100% covered. So this is the reality for Pennsylvanians here in Philadelphia and across the state. Open enrollment ends January 15th. Don't wait that long. We all procrastinate. I procrastinate. But it starts today. Go to pennie.com, and there's enrollment assisters that are willing to sit down one-on-one if you need a little extra help to navigate the process. And you can also find them at pennie.com. With that, I'm going to hand it over to Commissioner Altman, who's been a real champion for consumers here in Pennsylvania.
Good afternoon, everyone. As Antoinette said, my name is Jessica Altman, and I have the privilege of serving as the Insurance Commissioner for the Commonwealth of Pennsylvania, as well as the chair of the Board of Directors for Pennie. First, I want to acknowledge Governor Wolf for his commitment to protecting Pennsylvanians and working to provide pathways to healthier tomorrows. I also want to thank Mayor Pennie for hosting us here today and for all of his efforts to improve the lives and the health of Philadelphians. And a final thank you to Pennie, including its board represented here by LaValle Miller-Wilson, as well as Antoinette Krause, in addition to myself, for their dedication to consumers. The team, led by Zach Sherman, continuously works to make purchasing health insurance a transparent and easy process, and their work is resulting in meaningful results for Pennsylvanians. One of the insurance department's top priorities has always been to increase competition in healthcare across our counties, which ultimately presents more options to consumers looking for comprehensive health insurance plans that provide robust benefits. Despite COVID-19, Pennsylvania insurers have continued to expand their offerings and increase competition in many counties. In fact, this year's increased competition has resulted in more competition than Pennsylvania has ever seen on its health insurance marketplace. Not one county will lose an on-exchange insurer, and 25 counties will gain a new insurer offering coverage through Pennie. More specifically, 22 counties, including Philadelphia County, will gain one insurer, and 3 counties will gain 2 insurers. Every county in Pennsylvania will have at least 2 insurers offering coverage, and for the first time, some counties will have 6 insurers offering coverage. But coverage is not only more available than ever, it is also more affordable. The American Rescue Plan signed by President Biden earlier this year is providing more financial assistance, expanding assistance to more people, and providing more assistance to those already receiving it. We are already seeing these impacts make a difference for those who are currently enrolled in Pennie, as Antoinette outlined so well in her examples. These savings are providing real relief to those current customers and can be a game changer for thousands of Pennsylvanians who are uninsured during this open enrollment period. Executive Director Sherman will provide more details on that shortly. Along with the savings provided by the American Rescue Plan, through our reinsurance partnership with Pennie, premiums for 2022 are 5.5% lower than they would be without this program in place. The reinsurance program came from the same landmark 2019 legislation signed by Governor Wolf that also created Pennie. All of this gives us our most important message today. Health insurance has never been more within reach for Pennsylvanians, for all Pennsylvanians. Whether you have never enrolled or even been deterred from enrolling in coverage in the past because of cost, we could not more strongly encourage anyone who is without health insurance to visit pennie.com, that's PENNIE.com, to check out their coverage options before the open enrollment deadline of January 15th, 2022. With that, I'll just say thank you all again for being here, to all of my fellow speakers, and I'm going to introduce Pennie's Executive Director, Zachary Sherman, who will share additional information on Pennie's 2022 open enrollment period. Thank you.
Thank you, Commissioner. As the Commissioner mentioned, my name is Zach Sherman, and I'm the Executive Director of Pennie. Special thank you to the Governor and the Mayor for helping us announce the start of open enrollment today, and for Antoinette and LaValle being here and being the continuous champions of this program that they are. As a reminder, open enrollment runs from today, November 1, to January 15th, with December 15th being the deadline for coverage that begins New Year's Day. The increased subsidies from the American Rescue Plan will carry over for the 2022 coverage year, resulting in the largest and most impactful premium savings we've ever had during open enrollment. I think it's important to stress what these savings really mean for Pennsylvania families. One of the largest barriers to getting and keeping health insurance is finding a way to fit it into the monthly budget, along with all the other costs, all of the other daily costs, including housing, groceries, gas, childcare, other expenses. It's hard to justify the cost of health insurance for some, for some, health insurance isn't a daily need and is only thought of as something that is needed if something unexpected happens. I understand and appreciate the need to prioritize other daily and immediate necessities. That's just really been a reality for many. I'm also happy to share that we've made it easier, and that because of Pennie and the American Rescue Plan, fitting health insurance into your household budget is possible. And this is so very important because having health insurance is an imperative, as it is much more than just protection from the unexpected. It covers your prescriptions, mental health and behavioral services, regular doctor checkups, maternity and newborn care, and much, much more. So getting into some real-life numbers of the impact of these savings, last year, a 40-year-old making just over $19,000 a year was paying $66 a month for a silver plan through Pennie, and a family of four with a household income of $52,000 a year was paying $285 a month. Now, today, the entirety of the 40-year-old's monthly premium is covered, resulting in $0 monthly premium and annual savings of nearly $800. The family of four is now paying $87 a month, saving $2,300 throughout the year. Simply put, things are different. Things have changed, and for those who have opted out before, it's worth taking another look. No one is paying more than 8.5% of their household income for health coverage. 9 out of 10 of our customers qualify for savings, which have increased in value across the board for the low income, for working families, and for near retirees. We are also proud to share that we are enrolling more folks this year. We're renewing nearly 30% more customers than we did last year. This increase is the result of the transition to Pennie and the improved affordability of coverage created by the reinsurance program and the American Rescue Plan. If you thought health insurance was not worth it, we strongly encourage you to come back to Pennie.com and simply browse your options. I think many might be surprised to learn at one, how quickly you can get a quote, and two, how these costs really can fit into your 2022 budget. This is a different Pennie than it was even last year, and as the governor mentioned, we are working hard to break down inequity in access by communicating, educating, and assisting in the health insurance enrollment process in underinsured communities. We know that acquiring and honestly just understanding health insurance can be daunting. That's why we exist. We've created easy online tools so you can quickly see and filter the available plan options in your area. We also have a free, unbiased team of resources available to provide enrollment support for those looking for a bit more assistance. Pennie's goal is to get you from confused to covered. Our call center is staffed with dedicated resources ready to answer your questions and walk you through the process, and we can connect customers with Pennie certified assisters and brokers in their area who can provide hands-on help to get them covered. Anyone seeking coverage should go to Pennie.com before December 15th and enroll in one of the high-quality options available in their area. While the enrollment period ends on January 15th, 2022, as we mentioned, we urge you to come in sooner than that. We urge you to come in and enroll by December 15th to sign up for coverage that begins on January 1st. Anyone who misses the December 15th deadline has more time, but their coverage will begin when they sign up on February 1st. So again, Pennsylvanians interested in shopping for and purchasing health coverage through Pennie can visit Pennie.com or call the call center at 1-844-844-8040. Our call center is open from 8 a.m. to 7 p.m. Monday through Friday, and on Saturday from 8 a.m. to 1 p.m. Thank you for joining us today, and now I'd like to invite the governor back up to take some questions.
Any questions I can answer? Yeah, thanks. Okay, thank you, everybody. Thanks again.